Hi everyone. Every year, cancer claims nearly 700,000 lives across Africa, and many of these deaths occur because the disease is diagnosed too late. At the same time, the African continent carries approximately 24% of the world's disease burden but has only about 3% of the global healthcare workforce. These statistics highlight a critical healthcare gap that demands innovative solutions. Good morning, distinguished ladies and gentlemen, lecturer and fellow students. My name is Ishima Ben, and today I will present how Boho Biomedicals leverages artificial intelligence, strategic networking, and digital acceleration to transform healthcare access across the African continent. Let me first of all take you through what Boho Biomedicals is. Boho Biomedicals is an AI-powered digital healthcare company that seeks to transform healthcare delivery through artificial intelligence, machine learning, computer vision, and wearable healthcare technology. The company addresses one of Africa's greatest healthcare challenges, which is delayed disease diagnosis and limited access to specialist healthcare. Boho Biomedicals offers three primary services, which are AI-assisted cancer diagnosis, remote medical consultation, and the Biometric Watch, which helps to assess, to diagnose and analyze the whole body of the customer. Although artificial intelligence offers enormous opportunities, one major challenge slows its implementation across Africa. And I'm as well speaking out for biobiometrics, which is the same problem that we face every day. Artificial intelligence relies on large amounts of accurate healthcare data to make reliable predictions. Unfortunately, healthcare data across many African countries remains fragmented, incomplete, and difficult to access. This creates three major consequences, which are poor quality data reducing the accuracy of the AI diagnostic systems that we create every day. Second, inaccurate predictions reduce confidence among patients, healthcare professionals, investors, and policymakers. Third, which is last but not least, delayed or inaccurate diagnosis increases the risk of preventable diseases. Ladies and gentlemen, I want to remind you that the World Health Organization reports that Africa carries approximately 24% of the global disease burden, but it still has 3% of the world's healthcare workforce. This shortage presses tremendous pressure on the healthcare systems and demonstrates why AI powered solutions and healthcare systems are still needed and urgently needed on the market. Addressing this challenge requires collaboration rather than technology alone. For this reason, Boho Biomedicals has identified three strategic stakeholder groups. The first includes the Ministry of Health, the Rwanda Biomedical Center, and the hospitals, either the public or private hospitals. These stakeholders possess regulatory authority, healthcare infrastructure, and access to the clinical data. The second group includes the universities, researchers, doctors, and specialists. These partners contribute research expertise, improve AI model accuracy, and strengthen the public trust in the technology. The final group consists of the investors, technology companies who provide funding, digital infrastructure, and technical expertise necessary for the growth of the company. Together, these partnerships and stakeholders create an ecosystem capable of supporting sustainable healthcare innovation in Boho Biomedicals. Our networking strategy for the next 2 months prioritizes three main stakeholders we need to approach first. The first are the hospitals, whereby the hospitals provide access to patient data, clinical expertise, and opportunities to pilot our technology in real healthcare settings. In return, Boho Medicals will provide AI-powered diagnostic tools and healthcare workforce training. The second stakeholders are the universities and the research institutions. These institutions are going to contribute to the research, the student talent, and scientific credibility, whereby working together with these institutions are going to enable the Boho Biomedicals to continuously improve our AI models, collaborative publications, and access to the international research grants. The third is going to be the Ministry of Health together with the Rwanda Biomedical Center. This is going to be an institution. These institutions are really going to be necessary for the regulatory compliancy, healthcare policy alignment, and the national implementation of our project. To establish these partnerships, we will conduct formal meetings, participate in innovation forums, maintain continuous communication, and build long term institutional relationships through various different states and methods. Alongside networking, digital technologies will accelerate the business growth of our company. The first tool that we're going to use is called Trello. Trello enables efficient project management by assigning tasks, monitoring progress, improving collaboration, and ensuring every team member understands their responsibilities. The second part is going to be Zoho CRM. The Zoho CRM is going to help us manage the stakeholder relationships by tracking communication with hospitals, investors, universities, and government institutions, which is going to help us to automate follow ups, organizing stakeholder information, and strengthening long term collaboration. In all this, we can't forget that the company is going to now improve and gain, as well as implicate new technologies like the use of artificial intelligence and machine learning technologies, which are going to help and are going to be the core of Boho Biomedicals. These technologies are really going to help us analyze medical images, predict cancer risks, as well as support clinical decision making and continuously improve as a new healthcare data becomes available and accessible or to us, the private health companies. To ensure our services reach patients and healthcare partners, Boho Biomedicals will implement a comprehensive digital marketing strategy whereby we're going to use website, whereby our website serves as the central platform where patients can register, complete symptom assessments, book appointments, and access healthcare information. Through our business WhatsApp group, patients are going to receive appointment reminders, healthcare education, symptom screening, and follow up communication. Since WhatsApp is already used around Africa and all over very huge communities. Finally, we're going to imply the use of LinkedIn, whereby LinkedIn is going to support us by connecting us to the professional networks, including the investors' engagements, partnership development, and throughout the leadership by sharing research findings and the company achievements all over the world and to the relevant institutions and stakeholders. The success of Boho Biomedicals depends on aligning networking and digital innovation. Strategic partnerships enable access to hospitals, regulators, insurers, NGOs, and technology providers. Responsible healthcare data collaboration improves AI accuracy while ensuring ethical use and regulatory compliance. Improved AI models lead to better disease prediction, faster diagnosis, and stronger clinical decision support. So these improvements translate into higher quality healthcare services, particularly for underserved populations. Ultimately, increased patient trust, stronger partnerships, and better healthcare outcomes, driving business growth and creating a scalable healthcare solution for the African continent and for Rwanda as the best country of our operation. One of the greatest challenges that we're going to face and which we anticipate is ensuring the trust and commitment of key stakeholders and healthcare stakeholders. Many hospitals, governments, healthcare professionals, and patients remain cautious about artificial intelligence because of concerns surrounding data privacy, ethics, system reliability, and regulatory compliance. To overcome this challenge, we will prioritize transparency, ethical AI practices, and continuous stakeholder engagement, building partnerships with credible healthcare institutions, which will strengthen confidence in the platform. Using other different platforms like Zoho, CRM, and LinkedIn, like we said, this is going to enable us to reach our goal. By demonstrating real health improvements, Boho Biomedicals can build trust, strengthen partnerships, and accelerate the adoption of AI-powered healthcare solutions across Africa. Thank you very much for your attention. I would welcome questions if they are present. Thank you very much.